So remember I talk a little bit about dissonance and how we, particularly at end of life, maybe can understand cognitively what's going on, but still struggle with our emotional body, and that's totally normal. And sometimes we may understand cognitively that the person who is dying is dealing with a dying body. And so there's certain signs and symptoms of normal decline that occur when someone's dying. However, sometimes we maybe get something a little unexpected happen, or maybe we have to make other medical decisions about what's going on with this person who's dying, and we struggle. So I want to talk to you today about the dying body and how we need to form our expectations in terms of what's happening with it and why we don't do certain things versus others. Hi, I'm Abigail. I'm here to normalize conversations and education about death and dying so we die better at end of life. Let's get into it today. The dying body is going through its own process. And because of that, there are certain things that we do and or do not do because it can either benefit or not benefit from them. So today I want to talk to you about what does it mean to be in this dying body and what we should expect in terms of how it relates to the treatments and medical decisions we make for this person who is dying. So I want to just go through this briefly because I imagine if you're dealing with something like this, maybe you're overwhelmed already, but the dying body is not a body that is resilient. A dying body is not a body that is going to be able to cure itself physically, right? We talk about healing, in different other ways, but it's not going to be able to heal itself physically. And this is normal, and this is okay, and this is expected, and this is how it should be. I know, and I imagine you're probably listening to this right now, and you're like, yeah, duh, that's obvious. But when I've talked to people, they have needed to hear this more than anything because either they were emotionally overwhelmed or their emotions weren't able to catch up with their head yet. So a dying body is a dying body. So what does that mean? It means that it's experiencing organ failure from multiple organs and multiple systems of the body. So what does that mean in terms of medical care? Well, it means that certain medications and certain treatments, particularly the ones that are geared towards curing an illness or a condition, are really not going to work. The body doesn't have the reserves. It doesn't have all of the tools functioning like it did before the terminal diagnosis to really utilize those curative means and those curative treatments in full. So that would mean certain things like tube feeding, chemotherapy, radiation, things like that. Those things won't work on a terminal dying body than on a person who is not dying. Okay, so let me say that again. Those types of curative treatments won't work on a body that is dying. Okay, if anything, those treatments, those curative treatments like tube feeding, for example, if they're given to a dying body, can actually create more side effects, more discomfort, and even sometimes hasten death. Perfect case in point, tube feeding, for example. Now, I'm not saying you have to cut tube feeding completely. There are many, many thoughts, views. It's a very complex subject. You can do little tiny boluses of tube feeding to just, palliate someone's possible hunger. There are ways to work with this, but some people, they are admitted to hospice and they have a loved one who has been getting tube feeding around the clock, and they're getting pneumonia and respiratory infections, lung infections over and over again for a certain reason, because they're most likely aspirating. And what that means is that fluid that is going down to the stomach is not really being digested efficiently enough. So it's coming up from the digestive tract and going into the lungs and, causing what's called aspiration pneumonia. So basically the fluid is going into the lungs, the tube feeding is going into the lungs and causing an infection. And also not just that, but it's making it much harder for that person to breathe and oxygenate comfortably, meaning that they can't even breathe as comfortably. So that's just one example of many. Certain medications, for example, medications to help stimulate blood cell growth, things like that, take months to work already. But in a dying person's body, you really can't even have any assurance that it's going to work at all, because the body has to be able to make the red blood cells with the help of this medication. Things like that. Things like chemotherapy and radiation, the body has to be able to utilize these treatments effectively in order to do what, is said could happen, possibly shrinking a tumor. And can you even shrink the tumor and even shrink it to a size that's small enough to change any amount of the symptoms? Most likely not. I talk about this too in some of my other videos. So what I want to just remind you in a very simple way is that when you're dealing with someone who's on hospice and you're dealing with someone who is dying, remember they're in a dying body. Remember that body is going to consistently and continually decline, meaning that it's going to get weaker. You're going to have all these changes that occur. And from head to toe, you can see different changes: confusion, agitation, hallucinations, decrease in level of consciousness, lethargy, and then all other systems, they're all going to start to shut down. And with that is expected. Their vital signs, their heart rate's going to go up and down. Their breathing is going to change. It's going to go fast. It's going to go slow. They're eventually going to stop breathing. They're going to have things like falls. They're going to have a lot of weakness. They're going to stop going to the bathroom, where they start, losing continence. And all these things, they may start to develop wounds. This isn't anything saying or, accusing anybody of doing any poor care. When you start to see these things, these things happen. I can't tell you how many times I would have a nursing facility call and say, "Oh my gosh, the oxygen saturation." And they put this little a little clip on the finger to measure how much oxygen, is in the blood and how well it's oxygenating the tissues. I got so many times calls like, "Oh my gosh, the oxygen level is 80%. Normal is ideally you want like 95 to 100. Okay, depending if you have COPD, other respiratory infections, sometimes a lower one is actually normal for them. But so they freak out, and rightfully so. If you're not in hospice, you're not used to seeing that. But then, for a hospice person, it's like, oh yeah, we're kind of used to that. What we're really concerned about are the symptoms. Is this person struggling to breathe? What's their respiratory rate? All those things that we look at, and then we treat those symptoms. So in a dying body, we are focused on hospice in treating all the symptoms. We treat them aggressively to ensure that they remain comfortable and have a dignity, still left, in these last moments of life. So let me know if you have questions on this. While I imagine that a lot of this can seem very obvious, I can't tell you how many times at end of life, when someone was in a very highly emotional state, they needed to hear this again. So just let this sink in order to help prepare you, especially if you have a loved one that is nearing this stage, or you yourself are nearing this stage. And let me know, by all means, always let me know if there's a question that I can clarify for you, from this video or anything else. Leave them in the comments. I read every single one, and I will address every single one. Thank you so much. I really appreciate your time. Let's continue to normalize these conversations and education about death and dying, so we die better at end of life. I'll see you soon.